I'm a DPhil candidate at Balliol College here at University of Oxford. I'm doing that part-time, also working in plastic surgery as a registrar in London, and I'm on the Ideal steering committee, so plenty of things to talk about, and also involved with journals, so plenty of conflicts of interest as well to take note of. I just wanted to give you a brief overview of what we've been doing in terms of the research registry, why we need it, the background, what the results of it are so far, and then sort of plans going forward, and then happy to take some questions. So as you all know, especially in an audience like this, transparency is a major trend within healthcare research, and modern research ethics requires an explicit research protocol. And indeed, the Declaration of Helsinki in 2008 used to say every clinical trial must be registered in a publicly accessible database before recruitment of the first subject. And then in 2013, this actually changed and expanded into every research study, and that has implications because it's not just trials, then it could be cohort studies and all kinds of other studies that are now involved. If you look at GMC guidance on research, it says the same thing. It's now considered unethical not to have, and an act of misconduct not to have registered a study. But I feel that registries aren't fulfilling this mandate currently, and that's why I looked at this area and wanted to innovate in it. If you look at the focus traditionally of trial registration has been around this area, especially RCTs, but really with the change in the Declaration of Helsinki and really common sense and ethics, it's really a much wider pool of areas which should be registered. If you look at the current landscape, in 2000 both Biomed Central's controltrials.com was launched, as well as clinicaltrials.gov, and in 2011 Prospero for systematic reviews was launched. So this is an area which hasn't had a huge amount of innovation in terms of lots more global international registries. Now, I don't mean to go through this in any kind of detail because an audience like this will know all of this, but registration has multiple benefits for all kinds of stakeholders involved in this process. So in terms of improving transparency, the ethical side of it, aiding collaboration, reducing waste. These are all really important points, and people can find out what research is going on, and also negative publication bias, which is a major problem. And that's actually what we've said here. If you look at Chapman et al. In 2014 in the BMJ, they showed that 1 in 5 surgical RCTs are discontinued early, and 1 in 3 remains unpublished 2 years after their conclusion. And similar findings have been found by others. So there has been talk and need for a new registry. If you look at this paper here, the registration of observational studies, is it time? So that people weren't really registering observational studies before. It has come in a little bit, but there's a lot more to do. You can't really register any, there's nowhere we can register an ideal study, for instance, or a first-in-man study, so stage 1, 2A, 2B. There's no place that really says we want those studies. If you look at this paper, it talks about how to reduce waste, and one of the key areas it talks about is actually the monitoring of work in progress is really important, and that's the section that I've highlighted there. So I was very interested when I came across this set of data here. If you look at this chart on the right, which is from the Wall Street Journal, it showed how observational studies have increased over time. And in fact, from 2001 to 11, compared with the previous decade, it tripled. And you can see that with that graph at the top. But I looked at how many of these studies are actually registered on clinicaltrials.gov, and there's only 4,200 each year since 2010. So roughly that's 10% of the journals included in this particular group of journals, which is the ones looked at by ISI. So it's a smaller grouping, and it's only 10% of those. There's a huge number of studies, the overwhelming majority, which are unregistered. And that's, as we've seen from Prof. Dam's talk already, how many studies in urology were actually case series? The vast majority. So can the current landscape do the job? Well, I think there is a lack of awareness. That's the issue, because the clinical trials, the branding itself tells you that. If you look at most surgeons, their work is unregistered and it comes through to journals and there isn't a registration behind it unless it's an RCT, so people haven't got that awareness yet. But you need to make it really easy for them, and if you want to register something on clinicaltrials.gov, for instance, you need to have a protocol, a PRS account. There's only one person with that account per institution, and it can take several weeks to get registered. If you want to go to controlledtrials.com, that's £214 plus VAT for a registration, so it's expensive as well. So our goal was to register all study types involving human participants from first-in-man case reports, which is the ideal stage 1, all the way through to 2A, 2B, case series, prospective, retrospective cohorts, trials, systematic reviews, everything. We can allow prospective and retrospective registration. It will be free and simple to use, and it's the first ever registry really to be run by clinicians. So we've got a very small executive team. We've got an international advisory board, and it's very small and at the moment, but we're hoping to grow this. So we set about looking at our planning and technical build in March to December 2014, so thinking and planning about this. And then I built it when I was on holiday in late December 2014. So just needed a laptop, didn't need lots of programmers, just did it myself. That's the domain name, researchregistry.com. I integrated database and everything myself, and you'll be able to see this. It's based on the WHO's 20-item minimum data set. So everything that the other registries are recording, we're recording, and we're also recording additional items which are mentioned in the SPIRIT and STROBE reporting guidelines for these kinds of studies. And then we've been tinkering. In terms of the architecture, it's really been an agile development, so more like the bottom right picture than the bottom left. It's about being iterative in our design. It's cloud-based. There's data backup that happens in multiple areas. It's encrypted and it's fully scalable, and it can handle an enormous load of information. So when we initially did this, just to show you how we've changed things, when we initially had ethical approval as a box in which people had to write, and then people don't write anything, so then we had it as a drop-down, which makes it far more robust in terms of getting the information. The other thing we've done is we've integrated videos, so you can have surgical videos here, you can have diagrams, text, and that's things that you can't have in other registries. You can't upload videos like that. In fact, I went to a clinicaltrials.gov entry on nipple reconstruction, so an area that I'd be familiar with, so I'd really understand the technology that they're talking about and the technique and everything. And the only thing it tells you about this is those two words, nipple reconstruction. There's nothing else mentioned at the bottom right. There's nothing else on that entry mentioned other than, there's no other detail about the technique, about anything else at all. It's a complete lack of detail. Whereas on ours, you could have a video, you could have images, text, tables, everything. So we launched in 2015 and had a strong link, as you can imagine, with the International Journal of Surgery. And what we've done is we've said that every study that comes to us should be registered before it goes forward in the peer review process. And so we made it mandatory. Had a little editorial, and there's that's how it looks like. So you can see these kinds of studies that we're getting. So these are people that would have been an unregistered study coming to the IJS. We've said, you've got to register. They've gone back and then have had to register over here. And gradually more and more people have found out about it. And you can see even at the last but one, we're getting people registering things which aren't to do with surgery at all. It's to do with stroke. So it's expanded. We've also made it available for mobile. So this is from my phone. That's my phone, that's an entry, you can see that there, you can scroll. It looks completely reasonable. And you can see the Research Registry 324, so each one has its unique identifying number, which allows you to track it, and that's stable. The other thing that we do, which is unique, is we allow retrospective registration because, and by that I mean the study's been completed, and then you can still register it. And now you cannot register that study in another registry. They will ask you to register it before recruitment of the first subject. or first participant. Whereas a lot of surgery, they've already done the study, they're coming to you to publish it, and then you're going, well, you need to have it registered. So they still need to be able to do it. And the reason it's important to register them is because if journals reject that study, there will be no evidence it ever occurred. So we have to still learn from that. So that's another unique feature of what we do. So this comes from my editorial hat as well as my doctoral hat. If you look at we're getting more and more prospective studies as well. So here's one, the Medacta SMS femoral stem component, a multinational, multi-center clinical surveillance study from the South West London Orthopaedic Centre. And their follow-up is to be completed in 2027. So they really have faith in us. We're on Google, and if you search for them, we're their fifth link after their own links. So we're very searchable. So it's not just surgery, it's stroke, it's physiological therapies, it's chemotherapy at the top, Parkinson's disease. So lots of other people have registered their work with us. So how do we compare with the other registries? You can see that we're free to register. You can register any kind of study. You can register retrospectively, prospectively, and you get an immediate registration. So immediately you get the number. You don't have to wait weeks and weeks and weeks for it. And then we curate the data retrospectively, and we're managed by clinicians. And in fact, our brand values are very similar to Google's, free and comprehensive. So I don't think that's too bad a place to be. If you look at the registrations, we've now got 1,000 registrations. I looked today, it's exactly 1,000 when I checked this morning. And you can see how that has grown over this period. And you can see how it's cumulatively developed. We get submissions from 70 countries, with China being number 1, and UK, and so on. Thank you. And you can see the different kinds of studies as well. So all these studies that you would see here were previously unregistered, and hence they had to come to us. So in a large number of cases. So a lot of these retrospective studies, case series, but also prospective cohorts, ideal stage 1, and so on. So we've made a difference here. And here's a study an ideal study that has come through on robotic esophagectomy. And you can see at the end, we have the research registry number at the end of the manuscript. So you can see what the protocol would have been for this as well. You can track it all the way through. Another big problem that I faced when I talked about this to other editors in the journal is, why would people not be bothered to do this? Because they think it's too much work. But you can see our submissions have more than doubled before and after if you compare it. So it's a huge difference in submissions. It hasn't stopped anyone. Submissions have grown. They've doubled in this period. We've had an endorsement from Peter, who's very much in favour of it, in that it increases the number of things that can be registered at every stage. We're now number 1 for research registry, which previously clinical trials was. So we've taken them off the top post at Google, and you can see that we're raising awareness. We're talking about this. Just a quick mention about quality. We retrospectively curate our data, and in terms of how we do it, I looked at Austin Bradford Hill and how he evaluated a paper and what it should do. And so we mapped those to different fields in the registry, and then we looked at the compliance of that. And when you do that, which we've done for the first 500 studies, you can see how many have been deleted. So 88 studies have been deleted for not being appropriate for the registry, or there being animal studies or duplicates. And then we've analysed the quality, and it's increased hugely since the start. Plan going forward, more collaboration. The IGS is going to be launching a protocols journal, which is, I think, very important because there is no surgical protocols journal. And we're going to continue to try and develop this. So the conclusion is that we've had 1,000 registrations in 70 countries. It's the most comprehensive registry that exists. Over 1.9 million patients have been registered via studies, which otherwise would not have been. The quality indicators have gone up hugely, and I think it's true to the tenets of Declaration of Helsinki, and I want to thank all the people listed over here for helping out with this. Thank you very much.